So let's dig into some laser eye surgery secrets, the risks of laser eye surgery, and what's the downtime from having had laser eye surgery. So the risks are slightly different depending on the kind of laser eye surgery that we're talking about. With any kind of surgery, the first risk that we have to consider is the risk of infection. Now, the most modern corneal laser eye surgery, which is SMILE laser eye surgery and LASIK laser eye surgery, we now know from a substantial scientific evidence base that that risk is now down to 1 in 20,000. So the instruments that we use at Custom Vision Clinic are single-use disposable. So they come out of a sterile pack, they touch the patient, and then they go straight into the recycling bin. We use a separate set of sterile instruments for each eye for each of our patients. That's the gold standard of care. And so we can keep that infection risk right down. We put our patients on strong antibiotics straight after the surgery, and the tiny incisions have healed within a few hours of treatment. So the patient's defences against infection are back up in action within those few hours. Let's contrast that with the risk of contact lens related infection. So we know, again, from a large scientific evidence base, that there is an ongoing annual risk of 1 in 3,000 for contact lens wearers. So every time that individual is putting contact lenses in, soft contact lenses, even if they're obeying all of the guidelines on safe and good contact lens wear, they're taking that ongoing risk. And so you can see that the cumulative risk over time very soon starts to significantly outweigh the minuscule risk associated with infection from laser eye surgery. And that's really the main risk that we are worried about. There is a risk of weakening the cornea with laser eye surgery and causing a condition called ectasia. Now, ectasia can occur in the natural population. It's a condition called keratoconus, where the cornea becomes weaker. But we do know that very rarely after laser eye surgery it is possible to push an eye towards developing ectasia or keratoconus. The key here is to identify patients who have a slight tendency towards that before undertaking the treatment. And at Custom Vision Clinic we take additional scans, and we've purchased additional software to analyse those scans in order to be certain that our patients have strong, safe corneas before we undertake any treatment. Next, we make sure we're not greedy. So if it's a huge correction and we think that potentially we're going to be taking away too much tissue, we look at an alternative, and we have all the alternatives available. Commonly for our younger patients, we'll be able to offer them an ICL, an intraocular contact lens, as an excellent alternative to laser eye surgery, enhancing the safety of the laser eye surgery that we're performing and that we're offering. The other safety issue that we need to consider is the quality of our patient's vision afterwards. And I think there are still stories floating around the internet forums of patients suffering from night vision problems after laser eye surgery. And really these problems are historical. With modern treatments, the profiles that we use to reshape the cornea are beautiful, for want of another phrase. They're perfectly centered on the patient's visual axis, and they're large enough to cope with the patient's pupil even when they're dark adapted, for example, driving at night time. So again, with modern treatments, we have more of our patients coming back to the clinic to tell us that their night vision is better than it ever was in their spectacles or contact lenses than we do patients coming in saying that they think their night vision is a bit more glary. In the first few months after laser eye surgery, we do have about 10-15% of patients saying that their night vision is a little more glary, but this is trace inflammation in the cornea. It settles, and we find that after 6 months they're back to good quality night vision, but not wearing their spectacles or contact lenses. If we consider the Zeiss Visumax for a moment, this is our flat making laser that we use for LASIK laser eye surgery, and it's the laser that we use for SMILE keyhole laser eye surgery. This is extraordinarily gentle on the eye. So the patient's vision is maintained during the treatment, so their optic nerve and retina are perfectly safe. It's so gentle on the eye that there is no risk to the retina in terms of retinal detachment. Because it's so gentle on the eye, so you know how everything good has a flip side? So the only downside of it being so gentle on the eye is that it is possible during the surgery for the patient to pull their eye away from the suction cup that's holding the eye during the short period of lasering. If this happens, it's very simple for us to just put the cup back on and continue. There's one point during the treatment where if we lost suction, we wouldn't be able to continue with a SMILE procedure. At that point, we could decide to stop. The patient could decide, actually this isn't for me, we could give them their money back, and the next day their eye is literally like I've done nothing to it. They can put their spectacles on and they see just as normal. I can examine them on the slit lamp and there is no evidence that we were there, that we did anything. Now I can't think of a single other operation where you can start and stop and it's no foul. It's like, okay, this isn't going to work, let's just stop, and the patient has come to no harm at all. Alternatively, we can come up with an alternative plan for them. And this, in my career, this has happened on a couple of occasions, and we've just been able to move on a couple of hours later and undertake LASIK without compromise, perfect LASIK, and the following day the patient had a perfect outcome. And this is really the joy of working with modern laser eye surgery. It's the safety that's built into the technology that's looking after me. More importantly, it's looking after my patient. So the downtime after modern laser eye surgery is really very short. It is slightly different depending on whether we're treating long-sightedness or short-sightedness. The short-sighted patients, they do get it a bit easier. The cornea likes being flattened, and that's essentially what we're doing with laser eye surgery to treat short-sightedness, gently flattening the central part of the cornea. And these patients, they're like kids at Christmas time, on Christmas morning, day one after their LASIK or SMILE laser eye surgery. They wake up and their eyes are comfortable, they're seeing well, they can see the alarm clock, they open the curtains, they can look out the window. It's an incredibly rapid return to normal function, but without wearing their spectacles and contact lenses. In terms of downtime from their activities, as long as it's a relatively clean environment they work in, they can be back to work the next day. If it's a more challenging environment, a dirty environment, I think it would be sensible to have 2 or 3 days off. But after that, the surface is healed, it's strong, and they can get back to any kind of work. Showering is normal the next day, back in the gym, gentle exercise the following day will be absolutely fine. With SMILE laser eye surgery, they could resume contact sports within a couple of days. After LASIK laser eye surgery, best to avoid contact sports for a month after the surgery. Our long-sighted patients do have a slightly more challenging recovery. Well, really, anything's got to be more challenging than that. I mean, the short-sighted patients, it's just, thank you very much, I'm there. The cornea is a little bit more resistant to being steepened, and that's what we have to achieve for the patient in order to correct long-sightedness. In order to achieve a really great final outcome, and we know our final outcome at about 12 weeks after the surgery, the long-sighted corrections have to deliberately slightly overcorrect. And so I always have to warn my long-sighted patients before their LASIK laser eye surgery, on day one you're going to be amazed by your reading vision without glasses. And they will be amazed. These people, they're long-sighted, so they're blurry in distance without their specs or contact lenses, even worse for near. So they are blown away by the fact they can pick up their phone and read it without glasses. But because they're overcorrected, we've temporarily made them a little bit short-sighted. And so when they look up, they find that distance vision feels a little bit blurry, and it is. So very occasionally, I'll have a patient where we have to help them with a pair of temporary spectacles, just as their eye is healing and relaxing back out. So they can return to normal function, but they just might need a little bit of spectacle support temporarily. But once we get to 12 weeks, the vast majority of those patients have their final outcome, they've got their excellent unaided distance vision, and as long as they are in their 20s and 30s, early 40s, they'll be reading as well without glasses. If they're older, we'll have offered them presbyond, and again they'll be back to excellent distance and near vision without glasses. Do please book a consultation with me here at Custom Vision Clinic. You'll meet my team who will take you through a series of assessments and then have a consultation with me where I can collate all the data combined with information from you so that we can pull together a full assessment of your eye health and a treatment plan to improve your vision and increase your independence from spectacles.